to go through flexibility for middle-aged and older adults today. So what is flexibility? So flexibility refers to the ability of a joint or a series of joints to move through an unrestricted, pain-free, full range of motion. So in other words, what this means is the amount of movement possible given the structure of a joint. And flexibility is such an important part of your overall physical fitness. And many activities actually require flexibility. So if we think in terms of sport or physical activity, things like golf, swimming, dancing, as well as daily activities are also affected by flexibility. So our reaching, our bending, our twisting all require flexibility. And flexibility varies between individuals and is affected by joint types, different muscle lengths, ligaments, tendons, muscles, and skin, as well as physical activity, gender, and age. So in terms of physical activity, so the more training you do, the tighter you get. So you really need to pay attention to your flexibility. So as you're following our prime time program now, you're doing 2 exercise sessions per week, but we actually incorporate flexibility in there. But if you're feeling tight or stiff at all, you really need to be doing more flexibility training. So I'll speak about the recommendations a few slides down. Also, if you so on the opposite of physical activity, so you have our physical inactivity and sedentary behavior. So sedentary behavior would be if you're, say, for example, sitting down all day, whether you're driving at a computer or you're at home, you may find that your shoulders round forward. And this is because you have a decreased range of motion in your shoulder joints, okay? So I will find myself, if I don't push my chair into the desk that much and I don't keep me straight back, I'll find myself leaning over. And it's so easy to do, but you just have to watch your flexibility in your shoulders. In terms of gender then, so women consistently have greater range of motion across all measured joints compared to men, okay? But that will obviously depend on the amount of flexibility training that they're actually doing. In terms of age then, so flexibility typically decreases with age, and this results in significant changes in the neck, the shoulder, and the trunk region, okay? So a lot of people as they get older will actually have trouble with lifting their arms straight up in the air above their head, and when flexibility decreases with aging, it's also exacerbated by past injuries, degenerative joint diseases, and again, physical inactivity. So flexibility is so important. And how we train flexibility is through stretching. So stretching refers to exercises that move joints through their range of motion. So improving range of motion at the joints will eliminate any awkward or insufficient movements, and it'll allow you to move more freely. So to give everyone an example, so if you improve your range of motion at your hips and your hamstring muscles, which are the muscles located at the back of your thighs, you will actually ease the task of bending down to pick up groceries or bending over to tie your shoelaces, as well as increasing your stride when you're walking, you're jogging, and you're running. So important to increase your range of motion. So what are the benefits of flexibility? So improving circulation is the first one. So this means that you've got an increase in blood flow throughout the whole body, and that of course will bring oxygen and nutrients to your tissues, which is exactly what they need to function properly and also repair themselves. So really good. It also helps with breathing. So we can stretch muscles that actually help us breathe. So our diaphragm muscles, the muscles in our lower back, and around our chest. So that really helps us to breathe. And it improves the health of your neuromuscular system. So not only are you improving the health of your muscles, you're also improving the health of your nerves. And what overall are the practical benefits of having good flexibility, or why should we do flexibility training? So it helps to reduce stress and tension in the body. And so in the muscles, the body, and the mind. So the three. So it has a huge impact. It also facilitates pain-free and unrestricted movement. So if you already have pain and restricted movement, flexibility training will help improve that for you. It can also have practical benefits for preventing and treating injuries. So what we see a lot is a lot of injuries are caused by either muscle weakness or muscle tightness, and flexibility can really help to counteract that muscle tightness. So really, really good. It promotes overall well-being, so you're going to be able to move better, you're going to be able to function better. And stretching and functional movement will promote deep healing and restore physiological function. So it's one of the best things that you can do to repair and heal your body. So important. So in terms of the FIT principles, so these are the guidelines we use for exercise prescription. Frequency is the first one. So flexibility is recommended on greater than 2 to 3 days per week, but it's actually most effective when it's performed daily. So if you're tight and stiff, you may need to do this more often than somebody who's not as tight and stiff, but definitely 2 to 3 days per week. The intensity then is to stretch to the point of tension, but not pain. So if there's any pain at all, you need to go back a step. So if we take the example of a hamstring stretch, so you've done this in your classes, and so Ruth or Anne would ask you to bend your left knee, for example, and you would straighten your right leg and you lean down. If you lean down and you're feeling pain, you're going way too far. Okay, so you need to bring yourself back up, is what we mean by come back a step. And as you progress your flexibility training, you will be able to move down and down, okay? So don't be ever afraid if you need to take it back a step and you're not as flexible as other people, because as we said, flexibility varies from person to person. The same with like a quadricep stretch. So again, Ruth or Anne will ask you to put your hand on the wall or a chair, or you might be able to do balance appropriately. You lift your leg up and you hold it in your hand. Some people can't get their leg the whole way up. That is absolutely fine. Just need to work on flexibility. So in terms of time then, so time is a minimum of 5 minutes after each training session. And this is why we build this into your cool down all the time. And once per week, you should do a full 30-minute stretching routine. Okay, so we have previously sent a 27-minute flex and move class that we could do on demand. So we really, really recommend that you try and fit this in to your normal week in addition to your 2 exercise sessions with us. So that would give you another session, and so important, especially if you're feeling any tightness or stiffness or pain. In terms of type then, so type is a series of flexibility activities for each of the major muscle tendon units is recommended. So flexibility, like resistance training, is specific to the muscles that are actually and joints actually being stretched. So it's really, really important that you target all the major muscle groups. So that involves the shoulders, the chest, the neck, trunk, lower back, hips, posterior legs, anterior legs, and the ankles. So really, really targeting all the major muscle groups. And what is so important is the flexibility routine should be completed after a thorough warm-up or after an aerobic or resistance training session. And the reason for this is that by increasing the temperature of the muscle, it increases its ability to stretch. So don't just get up and decide to stretch, okay? You really need to incorporate a warm-up or do it at the end of the session, just to prevent any injuries or overstretching. So thinking of the common types of flexibility, so there's 4 main types of flexibility, but I'm just going to cover 2 today, which are the most common. And they are static flexibility and dynamic flexibility. And both of these methods involve moving a joint or joints through the end range or to the end of the range of motion. So when you think of static, okay, no movement, dynamic movement. And I'll go through each of the definitions now and some examples. But if you think of static, where there's no movement, we usually do this at the end of a session after a cool down. And dynamic is usually after the warm up because it involves movement. So that's just a quick distinction that you can think of. But static flexibility is defined as slowly moving a joint to a point of tension, but not pain, and holding the position for 10 to 30 seconds. So I've just given some examples below that you will know from the classes. So what I mean by elbow behind the head is when you lift up your arm and you drop your hand behind your head and you hold here for 10 seconds. So that is actually stretching your triceps muscle. Another one would be your standing quadricep stretch. Again, where I say Ruth and Anne will ask you to hold the wall and you can bring your leg up at the back and hold your foot. And you hold that again for 10 to 30 seconds. And what they actually recommend is a goal of 60 seconds of stretching time. So to attain that, you can either do 2 30-second stretches, or 4 15-second stretches, or 6 10-second stretches. Okay, so whatever you can do, and you'll be adjusting the time and duration and the repetitions based on individual needs. So again, flexibility is individual. You work up to what you can do. But try and get that goal of 60 seconds is why we usually repeat it a few times. And older adults can actually benefit from holding the stretch for 30 to 60 seconds. There seems to be greater flexibility gains than shorter duration stretches. So building that up is really, really important. In terms of dynamic flexibility then, so it's a gradual transition from one body position to another, and a progressive increase in the reach and range of motion as the movement is repeated several times. So for this one, the hold is for about 3 to 5 seconds, and we usually repeat this about 5 to 10 times. So the examples I've given here are the arm circles. So you'll know when you put your arms out and we go forward and back usually, and then possibly up and down. High knees then would be bringing your knees up in front, just to get the hamstrings moving, and foot circles. Okay, so we get that ankle flexibility in by moving our feet in all sorts of planes. So we always incorporate both these types of flexibility because they all have fantastic benefits for flexibility. And then your health homework. Okay, so we always give this at the end of the week. So it's to fit in our flex and move on demand exercise class into your week. So